Hello and welcome to the Equal Access training video. Today we'll be going over what a typical patient encounter would entail for HOQI volunteers, beginning from greeting the patient to taking vitals and finally presenting to the medical student. When greeting the patient, do so by saying their first and last name. Avoid the use of Mr. or Mrs. in an effort not to presume the gender of the patient. After meeting them warmly, then take them back to the vital station to begin the first part of the patient intake. While walking the patient back to the vital station, avoid asking them questions like how they are doing, as this could unintentionally allow for the release of private health information or PHI in the hallways. Instead, ask them whether they've been to the clinic before, or perhaps if they haven't, explain to them the clinic process. Measuring a patient's height is one of the simplest vitals to collect. Simply have the patient put their feet or heels against the wall and back straight. And if you're using a device that measures in centimeters, be cognizant that you may have to convert that to feet or vice versa. The next step is obtaining the patient's weight. This is a relatively simple process with the patient standing on top of the scale. Once you've measured their weight, feel free to show the patient the weight on the intake form, but try not to announce it out loud in the halls in case that would be something the patient's not comfortable with. Temperatures next up. If using a temple thermometer reader, ask the patient to take off any hat or glasses they have on and simply take the thermometer and swipe it from temple to temple while holding down the button. Once that's over, release the button and then that should be your value for your temperature. After you've obtained the temperature, make sure to clean the thermometer by simply wiping it with alcohol wipe and to make sure it's sterilized and dry for the next patient's use. Note that readings over 104 are considered red flags. Retake the temperature, and if the reading is still the same, immediately notify a medical student, as this might be an emergent case. The pulse oximeter device measures O2 saturation for patients. To administer the device, simply have the patient put up their finger at chest level. One easy way to do that is to have them place their finger on the clipboard and use that as a basis for measuring the pulse. O2 saturation levels lower than 90 are considered red flags. If you ever encounter this, make sure to retake the measurement and assess for signs of shortness of breath. If these are present, immediately take it to the medical student for further evaluation.
Hi, my name is Karthik, and I will be going over the general intake process with you. After taking your patient's vitals, kindly direct them to their assigned clinic room or intake location, depending on your clinic site. Upon entering the room, close the door behind you to ensure patient privacy and direct them to their seat. Before you continue with the rest of the intake process, be sure to wash your hands. To mitigate any lapses in conversation or impending silences, one approach is to ask them what brought them into clinic today, to provide context for when you hand off to the medical student. Upon yourself sitting down, be sure to explain to them that you're going to ask them a series of questions that mostly require brief yes or no answers. That way, the medical student and attending doctor can see them as soon as possible. Turn the computer screen toward them so that they can follow along if they're able to read. Familiarize yourself with the intake form so that you can make eye contact, paraphrase, and answer any follow-up questions that may arise from the patient. Mark down any pertinent information, such as referrals and past medical history. That way you can provide a brief summary of the patient's history to the medical student that you hand off to prior to they themselves entering. Taking manual blood pressure is a multi-step process that takes practice. We'll be going over some basic reminders that will help you get the most accurate reading possible, but as always, practicing is the best way to get better at it. First, make sure your patient is comfortable. Make sure they don't have their legs crossed. You want to know that their arm is relaxed and resting while you attach the cuff lining up the arrow on with the brachial artery. Make sure when you put on your stethoscope, the earpieces are facing away from you. Place the bell of the stethoscope on the brachial artery slightly below the bottom edge of the cuff. Do a quick check to make sure your patient's legs are still uncrossed, because sometimes they'll forget and recross them unknowingly. Pump the cuff up to 180 millimeters of mercury quickly. If they are hypertensive and they know their average blood pressure readings, adjust this upper limit accordingly. Release pressure slowly at about 3 millimeters of mercury per second. The first knocking sound is going to be a systolic blood pressure reading, or the top number, and the last nung sound is the diastolic blood pressure reading, or the bottom number. Current recommendations suggest that blood pressures above 140/90 should be closely monitored, but this may change depending on when you're viewing this video. For the purposes of our clinic, a systolic blood pressure over 160 or diastolic blood pressure over 100, plus symptoms consistent with hypertension such as headache, blurred vision, shortness of breath, chest pain, new onset of swelling, or hematuria should be closely monitored and noted. If either of these values are present, wait 1 to 3 minutes and repeat taking the measurement on the other arm. Average these two readings and make note of this on your medical student handoff form. Next, you will take the patient's pulse and obtain their respiration rate over the course of 1 minute. During the first 30 seconds, count the pulse and make a mental note of this. Then, without letting the patient know, count their respirations using your peripheral vision for the last 30 seconds. Letting your patient know you're counting their respirations usually leads to them consciously controlling their breathing instead of showing you their natural respiration rate. Make sure you also double these numbers to estimate their beats per minute and respirations per minute respectively. The normal pulse is anywhere between 60 to 100, and a respiration rate below 12 or above 25 is considered abnormal. If these abnormal findings are found, be sure to make a note of it to the medical student that you hand off to. Once you've written the patient's weight and blood pressure on the patient handoff form, you can describe the form mentioning the various specialty clinics if they showed interest in any of them. Also, make sure to show the EAC phone number, preferably by circling it, and let them know that they'll be getting a follow-up call from that number sometime within the next week. For efficiency, one approach would be to write the weight, blood pressure, and circle the phone number, then hand the form to the patient and describe it as you fill out their vitals on REDCap. After this, let the patient know you'll speak to a medical student and that they will be seen shortly. Lastly, we're going to talk about presenting to the medical student. Briefly summarize the main points of the patient's visit with the medical student and make them aware of any referrals the patient showed interest in or screenings that they are due for as appropriate. Make sure to also mention any red flag readings that you obtained while obtaining vitals. This way, the medical student will be able to meet the patient fully prepared and approach their visit in a patient-centered, culturally sensitive manner. After presenting and answering the questions that the medical student has, give yourself a pat on the back because you have completed the intake process. Follow a post-intake protocol based on your clinic site, which could include reading off vitals to your site officer or scanning appropriate paperwork onto the electronic medical records service. It's currently Practice Fusion for us. This process is used throughout all clinic sites to ensure the undergraduate volunteers, medical students, and attending physicians are working together as efficiently as possible to provide the best care they can to the underinsured and uninsured population of the Gainesville community. Thank you for making it to the end of this video. Best of luck with your clinic endeavors.